Welcome to The Human Element, presented by Whisk. I'm your host, Barb Biden, and in each episode, I sit down with CHROs and senior HR leaders to explore how AI, innovation, and human insight are reshaping the future of HR. We'll explore how technology is reshaping leadership, strategy, and the role of HR by sharing candid stories, practical ideas, and strategic perspectives to help you shape the future. The Human Element is brought to you by Whisk, the leader in agentic HR and creator of Harper, the world's first AI HR generalist. Learn how Harper can resolve up to 80% of routine HR tasks autonomously. Learn more about Whisk at whisk.com. Welcome to The Human Element. My guest today is Ashley Ridgeway-Washington. Ashley is the CEO and principal advisor of Leverage Group. Leverage Group is an AI advisory firm that is supporting healthcare and mid-sized organizations that are looking to get their AI strategy just right. Most recently, Ashley served as the CHRO at JPS Health Network. Ashley is a rare blend of HR strategist, attorney, and executive coach, and her experience spans healthcare, tech, and Fortune 500 companies. Before she was at JPS, she led global DEI strategy at Amazon, spent nearly 7 years as VP of HR at Christus Health, and built her own human capital consulting firm. She holds a Juris Doctor from Florida A&M University, a Master of Human Resources from Rollins College, and carries the SPHR and SHRM CP certifications. Ashley is also a Deloitte Next Generation CHRO Academy alum, a keynote speaker, one of Real Leader magazine's top keynotes to watch. And she is currently writing a book on the power of courage as a tool for transformation. I am so excited to have you on today, Ashley. Thanks for joining me.
So glad to be here.
So way back in COVID, you left healthcare, went to Amazon, and came back to healthcare. What does AI adoption look like when your workforce is more frontline, mission-driven, and still healing ultimately from the pandemic?
So, it's interesting that you would offer that question because a lot of times what we tend to think about AI support and productivity enhancement is around back office, right? But the possibilities are endless in healthcare. And so what it looks like is real-time materials management so that a tech on the floor actually can real-time in the palm of their hands know where inventory and where supplies are. AI can look like intervention and de-escalation in the palm of their hand as it relates to patient experience. So aside from what we typically think of in AI for healthcare, which is either diagnostics or revenue cycle, there are a lot of administrative and quite frankly, bottlenecks in healthcare that AI really can help alleviate the pressure point on the frontline associate.
Completely. And now you're consulting on AI in your own business. Where have you seen AI adoption fail because leaders are maybe treating it too much like just a tech project?
Sure. So that is exactly where AI fails. AI is a tool. It can serve lots of very important purposes, but ultimately decision rights and clarification of the problem really has to be led by leaders and has to be clarified. And so we think about AI kind of as this nebulous kind of magic wand, when in fact what it is a system that essentially takes large amounts of data and identifies patterns. It answers the question that we ask it, which means if we're unclear about the question that we're asking, if we don't know exactly what problem we're tackling, if we've not addressed our data, if we've not addressed workforce readiness and change management, and we've not thought about what it looks like in a scenario where maybe we're leaning on AI in a way that perhaps could cause skills atrophy, we have set ourselves up to be in a situation where we could see a failed implementation.
Got it. Well, so if AI adoption, right, is something that sits ultimately with human leaders, right, making it somewhat of a leadership problem, what is the leadership behavior that you think has to change first in order for AI adoption to be successful?
I think one, people have got to get real about what they know and they don't know. I think it's hard sometimes for leaders to admit that something is new and that they're not quite sure what it is and how it works and how to apply it in the context of the business. I think that this, unfortunately, will expose where there are leadership gaps and when there are rights gaps, because now AI has democratized solutions that before were barriers because they were cost prohibitive or they required too much effort or too much diversion of resources. And now something that used to take, $100,000 in a team of six can be done by my eighth grader, right? And so
Hmm.
now you have that ability. It doesn't mean that the thing that they're going after is a good idea. So what does that mean? That means leaders have got to be a lot clearer about the problem that they're solving. They've got to be a lot clearer about whether the solution they're building is actually going to solve that problem. And they've got to be a lot clearer about ultimately not only what AI can do, but what it should do within the ethical and governance context of their business.
That makes so much sense. And when it comes to AI specifically in healthcare, I love something that I've heard you say is that you want the employee experience to be so positive that patients can feel it, right? So
Yeah.
that's such an emotive statement. How does AI help you get there, and where does it risk getting in the way of that employee experience that you want to drive?
Sure. So, healthcare is the business of taking care of people. But I would submit to you that probably 50% to 60% of leadership's time is really spent doing something other than caring for the patient, right? Administrative
Hmm.
rigor, paperwork, aggregating data, reporting on that data, pulling together reports. And so many of the things that think about, a leadership team that's preparing for a board presentation that took 2 weeks. Now that can be reduced to a week. That time can be diverted to, quite frankly, more hands-on, high-touch strategic initiatives, and that trickles down to the front line. If my scheduler is no longer manually scheduling, and that's done for them, now they have the opportunity to round to help people determine whether or not they've got the right schedule or they've got a barrier in terms of childcare to a new schedule, or ultimately if that staffing matrix is right. And so those rote things are now off the table. Now you have time to really focus on the high touch, highly strategic work. And then I would submit to you, we're talking really a little bit more about what I call enterprise productivity, but we really haven't spent a lot of time talking about what I call individual productivity. And I'll give you
Okay.
an example. I have an agent that is in ChatGPT and one in Claude, and it's basically a chin check for me. So it's my alter ego. And so it allows me to check a bias. It allows me to check maybe when I'm being uber sensitive. And in some cases, when I feel maybe frustrated or don't quite have the words, I'm leveraging that tool to be more empathetic. I'm leveraging that tool to kind of navigate how I'm feeling so that I show up better for the team. And so those are tools that really do promote and drive empathy, and really do build the front line. Now, what I will also say is that you have to be judicious about how we're using AI and understand that it's not a magic wand, that we still
Hmm.
have decision rights, that we still have a responsibility, particularly in healthcare, to clinical competency, and that we should not allow AI to prohibit us or to lull us into not asking hard questions, not auditing and having rigorous oversight over what it is offering us, because it does hallucinate. It's not 100% accurate. And so we have to remain vigilant about that in healthcare, because the reality is the cost of skills atrophy in healthcare is human lives.
Completely. Could not agree more that we need to actually use more time. We have more time now, right, to be able to apply our human rigor to the outputs that we're getting from AI. So why we would apply less human rigor to that doesn't compute at all. And so I think that that's an important lesson for teams too. You talked a little bit about your scheduler and that example of freeing that person up to do more human work, not less. Where else have you seen AI free up an HR team to be more focused on the human aspects of what we do versus less focused?
Sure. You think about coaching entry level managers and emerging leaders. And so one of the things that I did was I actually built Ask Ashley. And it was basically a coaching agent that my business partners could ask V1 level questions to, so that we didn't have to necessarily, they didn't have to pull me for everything, right? And so much of what HR is doing, particularly in small and medium organizations, is robotic process automation. Talking about things like absence management, which takes a lot of time. We're talking about things like labor planning and workforce strategy planning that really is very heavily influenced by data and aggregate data that is cyclical and coming in all the time. So you think about automating that. You think about
Hmm.
things like simple onboarding off cycle or off cycle pay when we have an off cycle pay situation. All of those things typically are very manual, very time consuming, and they can all be automated through something
Hmm.
as simple as robotic process automation. And so now what you have is a workforce that is not bogged down with administrative rigor, and they can now start to focus on more high level strategic work, succession planning, helping coach leaders for success, helping identify top talent and developing that talent, and really being clear that they are a business partner to the business by learning more and immersing themselves in business matters.
Totally. We can actually properly get to the things that we
Absolutely.
should have and wanted to be getting to, but we're maybe not giving enough time to when we were bogged down in administrative processes. I think is part of what you're saying there. You also have said that you view engagement as a mindset, not a program. Could not agree more with that. How do you keep that intact while automating?
Sure. I mean, I believe that there are some things that never get touched by AI. There are some inherently human things that should remain inherently human. And how we engage with people should actually be improved by AI, because arguably we should be less distracted by administrative rigor, by pain points, by manual things that distract us from day-to-day engagement. And so arguably employees should be more focused on engaging with patients, more focused on engaging with others in collaboration and problem solving, higher level critical thinking about why things are working the way they are. And the other part that I would say is, if you successfully implement AI in your organization, you've done a few things. You've aggregated data and got it in one place, so you've got a data lake. You've done some work at least around understanding what the strategic imperatives are and what problems you need to solve. And hopefully you've built some governance and some ethics so that you know where AI plays and where it doesn't. That clarity is not just positive for AI. It is the same clarity that you need in business and that we've always needed in business, to
Hmm.
ensure that our employees understand clearly what it is that they're going after and how what they do every single day really helps further that goal.
I agree. I want to hop around a little bit to your time spent outside of healthcare when you went to Amazon. And I'm curious, in going to Amazon's tech culture, what did you bring back to your work in healthcare and other places that you feel is working? And also, what did you need to unlearn?
Sure. So, the first thing that I would say is that in healthcare, historically, there's been this built-in client base, right? People come to you, they
Yep.
don't really have a choice. That's very different than at Amazon, which is a retail and tech giant. You are earning the customer's trust every single interaction. And what
Hmm.
that means is there's a customer first, kind of customer obsessed mindset that, quite frankly, healthcare could learn a lot from. Right?
Hmm.
Consumerism and employment, consumerism in healthcare has really emerged and really been kind of shot off like a rocket in the last 7 to 10 years. And quite frankly, tech and retail already had that figured out. And so I learned so much about how to work with service excellence. I learned so much about thinking through the eyes of the product owner, right? And so through the eyes of the patient, I learned so much about speed to market, right? Because in retail and healthcare, I mean, in retail and tech environments, speed is king, where in healthcare, often we chew a thing till it's dead, right? And so, how we are leveraging speed to add value. And then, last but certainly not least, I learned that I prefer people to widgets. And so, I came back to healthcare because I really feel strongly about mission centered human first work. Part of the tech and retail ideology, I really felt there was a lot of focus on greed. I felt like there was quite a bit of focus on things that really, at the end of the day, didn't galvanize the human experience. And I'm not saying any of those things are not good things. They just weren't things for me, right? I would also say that while I had to unlearn healthcare nice because we really struggle with courage in healthcare, I also, as
Mhm.
I came back into healthcare, had to swing that pendulum back a little bit because people are ruthlessly honest in those environments, and so there is a edge that just is not palatable in healthcare. And so it was a master class in so many things that I brought back to healthcare, and I learned so much about myself, and I'm grateful for that time.
Completely. That must have been such an interesting and exciting transition, but such powerful things to bring back into a healthcare environment that I'm sure doesn't happen every day, right? I think healthcare can be an industry where people spend sort of their entire career. So how valuable for you that you've been able to step out and bring the best of your learnings back as well. So I want to shift maybe into AI design, and maybe this actually relates even more to some of the work that you're doing now for the HR leader, sorry, who is wanting AI to feel human first. What is one design principle that you would suggest that they start with?
At the end of the day, what I would say is that you understand that training and voice are critical in building AI that feels human first, right? You have to keep in mind that AI, in many respects, particularly in small and medium organizations in healthcare, where we're using things like robotic process automation and agents, and we're not building really expensive, high stakes kind of AI technology. You have to train it. It is an intern. And so you have to train it in voice and tone, you have to train it in context, and that is where your experience is unparalleled, right? That is why experience is so important in adopting AI that is human centered and that is actually relevant and usable to the end user. Is that the context is what makes the difference? And I would say beyond that, I think there has to be clarity and agreement about what we will never allow AI to lead and make a decision about, right? These are the things that we allow AI to make a decision about. These are the things that nobody will ever delegate to AI, and here are the reasons why. I think that's so important. I wrote an article on Substack, I guess now about a month ago, that talked about some of the things that organizations have got to do, right? Even if you decide that
Hmm.
AI is a big hoax and you don't want to be a part of it, you need to know that your staff is using it, right? They are seeing
Yep.
the productivity gains and they're using it. And while you're in a strategy meeting, kind of come up with a value proposition and a plan, people are using it in your organization and probably using it irresponsibly, right? And
Right.
so at
Agreed.
minimum, people need to be establishing guardrails for what is inbounds and what is out of bounds, what is considered ethical within the context of that organization and what's not, and how we're going to use AI in a way that feels organic, that alleviates pain points, and that emboldens trust and transparency with our workforce.
Totally. And I think that I would love to have us dive in to this one can take us anywhere. So I'm kind of excited about this question is really what is top of mind for you right now. So not the conference answer, but the thing that you're really thinking when you kind of can't sleep at night, that's sort of an issue.
So, part of delving into AI is understanding what it does to improve people's lives and in the ways that it can damage people's lives. And this is not actually work related, but it's been top of mind for me because I think it speaks to the imperative of readiness and education and literacy in the AI space. I read an article that was just last week about two young boys in a rural school in Pennsylvania who utilized AI to essentially create deep fake, inappropriate images of classmates, pornographic images of classmates. And it was very tawdry, but it was also 14 and 15-year-old boys being dumb.
Yeah.
And it reverberated through this very small community, and those young men have been charged with 15 felonies.
Life impacting,
Life
right? Like,
impacting, life altering, and I think that
yes.
is what keeps me up at night as it relates to the burden and the benefit of AI. I feel like it is fairly, reckless of organizations not to incorporate workforce development around AI literacy and guardrails, and not to empower the workforce. And beyond that, even at home, their children to understand the burden and the benefit of AI and to be clear about how you leverage it and how you don't leverage it, because there are real world implications for it. And I think it is particularly true in healthcare, where we are supporting vulnerable populations, where we are having access to information that really could be damaging to people's future. It is so important that we are starting with literacy. It looks magic, it looks wonderful, it does a lot. But if we don't foundationally understand what we should be doing, what we shouldn't be doing, what is appropriate, what's not, what it is, and how it works, we have set ourselves up to really put ourselves in a very perilous situation.
That is very, very powerful. And things are moving so quickly that I think what you're saying is essentially that it's irresponsible, right, of us as we embrace AI, which you are encouraging, right, and it's something you're
Absolutely.
working on in your practice, have worked on as a CHRO, but it's embrace, but the responsibility around establishing guardrails, what you will and won't do, is absolutely fundamental. And we can't run so fast that we forget about that. So, Ashley, you're also writing a book about courage. Is there a courage challenge that you have faced recently in running your consultancy or in your prior role?
Sure. So, I mean, I think courage challenges are pervasive right now because let's just be honest, we're living in a pretty polarized geopolitical time where the
Mhm.
cost of being courageous and the cost of speaking up against things or in favor or oppositional to things can be much higher than it was, I'd say, 10 or 15 years ago. It doesn't mean that it's not worth it. And so, one of the things that I was recently having a conversation with a prospective client was around value proposition for consultants. And so this particular client is a consultant. He bills hours. And he said, if I use AI to cut my time in half, then, that can be tricky, right? And I said, you're right. But there's an opportunity to reposition that time and that value proposition and use that time differently to really think about how to leverage AI, and that may impact your profitability model. It may impact your employee workforce and not actually have those transparent conversations as it relates to business strategy as you're sitting with your teams, I think really is a misstep, a courage misstep, but it's hard, right? And so that balancing act is something that leaders have really got to, that tension is something that leaders have got to deal with all the time. How are
Every
you
day.
transparent with your team about the future amidst AI, but how are you also holding the vision and keeping them optimistic about the fact that just like when electricity came into play, lamplighters went away. There were other jobs, there were new jobs that those lamplighters were able to do. There was some friction along the way, but change and evolution is the only certainty in life. And so it takes a courageous leader to say that. It takes a quite frankly a high integrity leader to be able to say the thing that many people are thinking, but no one will quite stand up and say. And so we need more of that in leadership, particularly in healthcare.
Absolutely. Strong leaders at this time, both in the world and in business and technology, and the things that are shifting has never been more critical because we are really navigating folks through times that feel very different than certainly anything I've experienced in the 30 years that I've been in the workforce. And Ashley, I could dive in deeper there, but I'm going to hit you with one more question before we move into our lightning round. The time always flies by. If you could solve just one thing for yourself as a leader right now, what would it be?
Using AI or just in general?
In general, can be anything.
I would say the talent challenge we have with our new grads coming out of school. They have been reared in a world that is different than the business world they're entering. And I think me included, because I have a 23-year-old, we've done a poor job of preparing them to step into a different microcosm and be able to thrive there. And so I've been thinking a lot about how we start to identify opportunities to support young professionals to be successful in the workplace that exists today.
I love that one. Top of mind for me too. I had shared I have a 20-year-old and a 22-year-old, so I'm right there with you and feel it more acutely, even as someone who hires, right? Hires new grads, but I'm going to have two of my own. I do worry about what that needs to look like and how do we both prepare them, but also as HR leaders, how do we prepare to receive the sort of incoming class of new college graduates and ready them to work in this environment. So that was great, Ashley. I'm going to bring us into the lightning round here. Some quick hit questions. What is one thing that every HR leader should do right now to prepare for where AI is headed and that most are not doing?
Get curious and stay curious. There are a ton of free resources out there. Follow me on LinkedIn. I forward something I call free game all the time. Explore, play with AI, go to the free classes, do the micro learning, stay curious and stay relevant because things are moving fast. And you ultimately are going to be charged with getting the workforce ready to meet the demands and, quite frankly, both the interpersonal and the technical demands of AI coming into the workforce in a sustained and kind of permanent way.
What is one HR task that you would hand to an AI agent tomorrow and never think about again?
Absence management. So when people are calling in and saying, I'm going to be sick today, I will give it to them tomorrow and never look back.
Awesome. Same. What is one myth about leading through change that you wish would just go away?
That the slogan is the system because we say it, we're actually living it. And the reality is to say we're going to navigate change, to say that we're engaging in change management is not to actually change manage. And many
Mhm.
times in organizations, what we see is that we are talking the talk, but we're not actually undertaking the behaviors and building the systems that effectuate what it is we say we want to accomplish.
Yeah, I personally think if you don't even need the label of change management as like an outward facing term, if you are actually engaging in the right behaviors associated with driving change, the label is not the thing that's doing it for you. So I could not agree more. So finish this sentence for me. The HR leaders who will matter most in the next decade are the ones who blank.
Prioritize digital mindset, have strong partnerships with their IT and communications partners, and lean into driving cost leadership through AI in a responsible way.
Excellent. So I don't know if you caught me over here frantically writing as we were talking. I try to make sure to get a few nuggets that I can share to bring us home. I have more than enough here to pick from. So number one takeaway that I had was not to treat AI implementation as a tech project. AI projects, like other projects, are led by human leaders, and this moment requires human leadership and decision making. So loved that insight. Second was you talked about how focused we are, which I agree, on enterprise productivity. Think about AI for individual productivity. I'm actually going to tie that also to your Ask Ashley tool that you made for your coaching clients and business partners. But asking guests, like, what does your version of Ask Ashley look like? If you were going to introduce individual productivity into the world, what could you create there that could really help elevate just your individual performance as a leader or a team member or a person, right, as a human. And last but not least, the responsible use of AI. And I liked the framing of literacy and guardrails, right? Being we need to understand what it is, what it does, and then have the right guardrails that are clear and help us to really delineate what we are going to do with AI and what we are not going to do with AI. This stuff is moving super fast, and we can't let it go so fast that we cease to do this responsibly. So loved what you had to say there. So like I always do, I want to let you bring it home with one last question. Ashley, what is it that you want the HR leader who just listened to us talk today to think about on their drive home?
That this is an exciting time to lead people. And that at the end of the day, whether we love it or don't love it, we are truly the culture stewards of the organization. And so part of cultural evolution in this era requires us to adopt a new skill set. And that's exciting because we prioritize growth mindset and we lead with curiosity. So, in amidst all the things that you're doing, remember why you chose this work, why this work is important, and that you're integral to the success of the future workforce.
I love that you've asked us to anchor back to that because that's why most of us have gotten into this work in the first place. It was lovely chatting with you today. Thank you so much for coming on the show and sharing your wisdom with our listeners.
Thank you so much for having me, and it was a great conversation. Thanks again, Barb.
Thank you for joining us on The Human Element, presented by Whisk. If you enjoyed this conversation, be sure to follow The Human Element wherever you get your podcasts. I'm Barb Biden. Thanks for listening, and we'll see you next time.